Without delaying, we'll start just from where we ended. So last question was that, and we'll start from here. 365 number questions. 60-year-old male patient presented with swelling in his right angle region. Patient gives history of initial peanut-sized swelling 5 years back, which gradually increased in size and attained the present size. Diagnose the condition. So it is present at the angle of the mandible. Patient is 60 years old, gradually increasing since 5 years. Options are dentigerous cyst, dentoalveolar abscess, amyloblastoma, adenomatoid odontogenic tumor. As per the answer key, the answer is amyloblastoma. So we'll directly go to the explanation part. Focus on 365 explanation. Ameloblastoma is a true neoplasm of enamel organ type which does not undergo differentiation to the point of enamel formation. It has been very aptly described by Robinson as tumor that is usually unicentric, non-functional in growth, anatomically benign and clinically persistent. Radiologically, it shows destruction and expansion of bone. Now focus on 366 number question. 25-year-old female patient preparing for her postgraduate entrance exam presented with difficulty in eating food, pain, irritation over the tongue region. Identify. You can see in this picture how it looks like, how this ulcer looks like, and you can find a key term in the question that patient is in emotional stress. That is, she is preparing for her postgraduate entrance exam and suddenly this kind of ulcer appears. So mostly it's aphthous ulcer. Now we'll see what are the options. Herpetic ulcers, lichenoid reactions, pemphigus, canker sore. So the answer must be canker sore. It's a variant of aphthous ulcer, recurrent aphthous minor. So the answer is, as per the answer key, yes, it is D, canker sore. So this is a very easy question but important also. Now we'll go to the next question. Now you can focus in 367 number question. Unilateral distribution of angiomatous malformation seen in the below picture is a pathognomonic feature of which syndrome? So first see the malformation. This is a angiomatous malformation. Now the options are Osler-Weber-Induced syndrome, Sturge-Weber syndrome, Crest syndrome, Maffucci syndrome. So it is the Sturge-Weber syndrome. It's a unilateral distribution. This is the key term, unilateral distribution of angiomatous malformation seen in Sturge-Weber syndrome. There are other characteristic feature of the syndrome also. We'll see at the discussion part. Focus on 367 number question. Explanation. Sturge-Weber syndrome consists of congenital hamartomatous malformations that may affect the eye, skin and the central nervous system at different times, characterized by the combination of venous angioma of leptomeninges over the cerebral cortex with ipsilateral angiomatous lesion of the face and sometimes skull, jaws and oral soft tissues. The unilateral distribution of angiomatous malformation which never cross the midline is pathognomonic of this syndrome. Sturge-Weber syndrome belongs to a group of disease collectively known as phacomatosis, mother spot diseases. So these are the important points. We'll go to the another question. 368 number questions. 40-year male patient reported with pain in his tongue and lip region. On examination, there are ill-defined, irregularly shaped erosions of the tongue and lip region. So first see the picture. These are described as a ill-defined, irregularly shaped erosions on the tongue and lip region. So what may be the diagnosis? Options are lichen planus, lupus erythematosus, pemphigus vulgaris, verrucous leukoplakia. As per the answer key, the answer is C, that is pemphigus vulgaris. Pemphigus vulgaris. We'll go to the explanation part. Now the explanation part of the question. Pemphigus vulgaris is an autoimmune intraepithelial blistering disease affecting the skin and mucous membrane and is mediated by circulating autoantibodies directed against keratinocyte cell surfaces. Mucous membranes typically are first affected in pemphigus vulgaris. Patients have ill-defined, irregularly shaped gingival, buccal or palatine erosions which are painful and slow to heal. So this is the classification. We'll go to the next question. 369 number questions. 55-year-old chronic smoker presented with a grayish-white palate with small nodular excrescences having small central red spots. What does the small central red spot signify? So here key point, patient is chronic smoker and he is having these red spots, small nodular lesion and with central red spot. You can see here, so the picture is not very clear. Now it is a very easy question, I think. Options are inflamed orifices of major salivary glands. There are no major salivary glands opening at the palate, so this must be it's wrong. Next, inflamed orifices of minor salivary glands. Yes, this is the correct answer, though we'll read other options also. C, edema, and D, petechiae of the oral mucosa. So here the answer is inflamed orifices of minor salivary glands. So B is the answer. Now focus on the next question, 370. Identify the nodular mass near the base of tongue. There is a structure, nodular structure, that is present near the base of the tongue. Option A, enlarged circumvallate papillae. B, median rhomboid glossitis. D, lingual thyroid. D, tonsillitis. So answer is it's a lingual thyroid. It's a fairly easy question. Next, malar rash signifies which disease? Malar rash. Can you see the picture? It's a photo of a woman. There is a rash at the malar region. You can close your eye and you can answer. Options are melasma, xeroderma pigmentosum, epidermolysis bullosa, systemic lupus erythematosus. So butterfly rash or malar rash signifies systemic lupus erythematosus. D is the answer. We'll go to the next question. What does the small yellow spots near the buccal mucosa in the below picture signify? So it is present at the buccal mucosa and the spots are yellow, small yellow. I think you can make out from this picture, though it's not clear picture. It is a buccal mucosa and having small yellow spots. Now the options are opening of minor salivary gland duct, opening of Stenson duct, heteropic collection of sebaceous glands, collection of mucous glands. The answer is C, heteropic collection of sebaceous glands. Now go to the next question. Slowly enlarging painless mass seen in the floor of the mouth as shown in the below picture. Options are hemangioma, ranula, lingual thyroid, none of the above. So the swelling is in the floor of the mouth and slowly enlarging painless mass. The answer is ranula. Answer is option B, ranula. So this much for today. we'll make another video with next set of question. Thank you.